It's my pleasure to introduce our next speaker, Kennedy Borle. Kennedy is a board-certified genetic counselor and a PhD student in interdisciplinary studies here at UBC. Her research and her talk is about the unmet need for genetic testing and counseling and how that could actually help us achieve a better health equity. Kennedy.
Hello everyone, my name is Kennedy Borle and I'm a genetic counselor. You may be wondering what that means, but first I'm going to tell you what it doesn't mean. I can't bring dinosaurs back to life and I can't give people superpowers, but what I can do is help people to make meaning of genetic information and use it in alignment with their values, wants, and needs in the context of uncertainty. Genetic counselors are master's-trained healthcare providers who work within the healthcare system to support patients and families who have a genetic condition. This can include rare diseases like cystic fibrosis or sickle cell disease, and more common complex conditions like cancer and heart disease. I just want to take a moment to talk about the difference between genetic testing and genetic counseling. Genetic testing is a type of technology that's used to look at our DNA or genes to try to find an explanation for why somebody has a specific health condition. Genetic counseling is the education and support to turn that information into something useful. Also, genetic counseling can be useful even when there's no genetic testing available. It can help people to make sense of their family histories, to better understand their own chances of developing a health condition in the future, and it can also help people deal with the complex feelings of guilt, shame, grief, and blame that are often experienced when somebody has a condition that runs in their family. I became a genetic counselor because I wanted to help people not only understand genetic information, but feel empowered to use it to improve their health and well-being. When I first started working in clinical practice, I very quickly realized there were lots of people who could benefit from genetic counseling who weren't able to access care. It's well documented that the major users of clinical genetic services in North America are highly educated white women, and I was seeing this in my own clinical practice as well. And in addition to this inequitable access, I was also seeing really long wait times for care. Wait times for clinical genetics in Canada can be over 2 years. So it was at this point that I felt that I could do more good by approaching these questions of access and equity from a policy perspective, and this is what led me into pursuing a PhD. As Sir mentioned, my doctoral research is about trying to figure out how many people in Canada actually need genetic counseling and testing, and how can we work on advancing more equitable access to services. Through this research, we found a very striking statistic. We found that up to 39% of Canadians may have unmet need for genetic counseling. And this is a very high number. This is much higher than we were expecting to find through this study. And to put this into context, this is even higher than unmet need for dental health care in some parts of the country. We found that unmet need for genetic counseling was more likely in people who had mental health concerns, people who were younger, and people who had lower levels of functioning, all of which are already associated with barriers to health care. We also found that almost 70% of the people in our study who had unmet need for genetic counseling didn't specifically know that they needed genetic counseling, which shows us that lack of awareness is a major contributor to this problem. And this is really related to public scholarship, which I'll talk about in a minute here. We also found that 25% of our participants also self-reported that they needed genetic testing. And we wanted to better understand what people's experiences were with unmet need for genetic testing, so we did follow-up interviews with some of these people. We found that people had really high expectations for genetic testing, and they came up with a whole list of benefits that they thought that they would receive if they were able to access genetic testing. This included things like improved access to treatment, helping them psychologically cope with the condition, and helping with family planning. However, even though people were identifying all these potential benefits from having genetic testing, the types of conditions that they felt they needed testing for were things that, although they run in families, they're not conditions that we actually do testing for. And this includes things like diabetes and mental health conditions. The problem with this is that these unmet expectations around genetic testing were actually leading to harm for people because they felt that the healthcare system was actively withholding care from them that they felt would make them better. And this was leading to a sense of medical distrust and dissatisfaction with the healthcare system. Also, many of the people in this study actually needed genetic counseling, the support and education around genetic information rather than a genetic test. And it's possible that a lack of awareness about genetic counseling was leading to people self-identifying that they needed genetic testing instead. As it's been said today, health equity is defined as the fair opportunity for individuals to reach their full health potential. And what we're seeing right now in clinical genetics is that this isn't the case. And part of this is due to a lack of awareness about genetic counseling and limited understanding about how and when we actually do genetic testing. So this brings me back into talking a little bit about public scholarship. Because we know that lack of awareness is a major contributor to this issue, that means that every time I have the opportunity to present about genetic counseling and potentially let some of you know about what it is and how and when we do genetic testing, this is a potential opportunity to actually advance health equity through health education and public health messaging around these topics. So you might be sitting here today wondering if you need genetic counseling, and I'd like you to consider the following questions. Do you have a condition that may be genetic? Do you have concerns about a condition that runs in your family? Do you have questions about genetic testing? And are you experiencing feelings like guilt, shame, confusion, or helplessness about a condition that you have or one that runs in your family? If any of these apply to you, then you might benefit from genetic counseling. So there are a few different ways that you can be connected with a genetic counselor in BC. If you have a family doctor, this is definitely something you can talk to them about. But if you don't, there's a tool here that was created by the Canadian Association of Genetic Counselors. So you can check out this link or scan the QR code in order to find a tool about how to find a clinic near you. Many people may feel distress about their family histories, may wonder what a condition they have means for their other family members, or may want to improve their health using genetic information. And for these people, meeting with a genetic counselor can help them feel more supported in these goals. In addition to the research that I presented today, I'm also involved in research that's looking into other ways that we can deliver and organize clinical genetic services in BC in order to advance health equity. And one of these research studies is looking at what happens if we actually integrate genetic counselors into primary care settings instead, as a way to meet patients where they are in order to provide them the care that they need. So with that, I'd like to thank you all for being here today, and I'd be happy to answer any questions or connect further later on today. Thank you.